And welcome back to my channel. Today I'm going to discuss with you what are the extrapyramidal syndromes. Before that, we need to know what is pyramidal and what is extrapyramidal. So there are two types of tracts. One is the pyramidal tract, which consists of the corticospinal tract and the corticobulbar tract, in which the corticospinal is a voluntary control over the body, which includes the lateral corticospinal and the anterior corticospinal. Talking about the corticobulbar tract, voluntary control over the face, head, and neck. Now we come for the extrapyramidal. It consists of rubrospinal, reticulospinal, vestibulospinal, and tectospinal, which is also known as colliculospinal. The rubrospinal has fine motor control. The reticulospinal has two. The medial one is causing contraction, which increases the tone, while the other, that is the lateral, relaxation and decreases the tone. The vestibulospinal is responsible for balance and posture. The tectospinal is responsible for head coordination. Now talking about the anatomy, it consists of caudate nucleus, putamen, globus pallidus, substantia nigra, subthalamic nucleus, and thalamus. Basal ganglia. Basal ganglia refers to a group of subcortical nuclei responsible primarily for motor control as well as other roles such as motor learning, executive functions, behaviors, and emotions. And disruption of the basal ganglia network forms the basis for several psychiatric and movement disorders. Talking about the classification of antipsychotic drugs, on pharmacological basis, they are classified into first generation with low potency, first generation with high potency, and second generation. In first generation, chlorpromazine, prochlorperazine, and thioridazine are the three drugs which are low potency. In first generation with high potency, it is flufenazine, haloperidol, pimozide, and thiothixane. Second generation, aripiprazole, escitalopine, clozapine, iloperidone, lurasidone, olanzapine, quetiapine, paliperidone, risperidone, ziprasidone. From this, only the red ones are important. Now, what are the clinical uses of the antipsychotics? We can say there are two uses. One is non-psychiatric or general use, and the other is psychiatric uses. Non-psychiatric consists of vomiting, vertigo, pain relief, hiccups, porphyria, relief of itching, facilitate sleep in insomnia clients, and migraine headache. Talking about the psychiatric uses, schizophrenia, organic brain syndrome with psychosis, manic and depressive illness, severe depression with psychotic features, mania, delusional disorders, agitated aggressive behavior in dementia, Gilles de la Tourette syndrome, impulsivity, Huntington's disease. These are the psychiatric uses of antipsychotics. Now we will learn about the dopaminergic pathways. There are four pathways: mesocortical, nigrostriatal, tuberoinfundibular, and mesolimbic. Talking about the nigrostriatal, It involves motor control, and blockade of striatal dopamine D2 receptors produces extrapyramidal syndromes. Mesolimbic. In mesolimbic pathway, there is blockade of limbic dopamine D2 receptors which may elevate positive symptoms of schizophrenia. Mesocortical. In mesocortical pathway, dopaminergic mechanisms in frontal cortex mediate cognitive functions. In tuberoinfundibular pathway, it provides inhibitory control of pituitary prolactin secretion. Now we'll learn about what are the side effects of haloperidol. Acute dystonia, Parkinsonism, akathisia, neuroleptic malignant syndrome, and tardive dyskinesis. Acute dystonia occurs in 1 to 5 days after the ingestion of the drug, which is uncontrolled muscle spasm of face, tongue, and neck. For this, the treatment is injection of procyclidine 10 mg IM. Parkinsonism. It occurs in 1 to 4 weeks. It shows signs and symptoms of rigidity, bradykinesia, and tremor. Here, the treatment is switching to atypical antipsychotics. Akathisia. It occurs 5 to 60 days and within 5 to 60 days after the ingestion, and it shows restlessness, irritability, and irresistible desire to move around. For this, the treatment is first line beta blocker, second line anticholinergics, third line benzodiazepines, fourth line amantadine or clonidine. Neuroleptic malignant syndrome. It takes weeks to months after the ingestion. Muscle rigidity, fever, unstable BP, myoglobinemia, altered mental status are the signs and symptoms. For this, the treatment is atypical and typical neuroleptics. Tardive dyskinesis. It is late. Tardive means late. Therefore, it takes months to years. And it shows involuntary painless movements of face and upper limbs. The treatment is atypical neuroleptics. Some complications of neuroleptic malignant syndromes are rhabdomyolysis, acute renal failure, acute respiratory failure, seizures, brain damage, myocardial infarction, disseminated intravascular coagulation, hepatic failure, E. coli fasciitis, and sepsis. That's all for today. Thank you.